Telehealth is about taking biometric readings, so taking readings in a patient's home using a series of technology which is home-based, easy to use, and at the patient's convenience. So let's give some examples. Blood pressure, measuring the oxygen levels in somebody's blood as well, measuring blood sugar levels as well for diabetics, and measuring weight. And actually having those readings taken on a daily basis, weekly basis, whatever is decided as clinically viable, and then transmitting them down a phone line to a clinician who can actually monitor that and actually then decide on what's actually happening with an individual. So it could be that everything is fine, it's within the parameters for that person, that their blood pressure is at a certain level, and that's then monitored. But it could be that it's outside of a series of parameters, and that's where we might see an intervention being needed, a call to the patient to understand exactly what's going on. It works with a series of questions as well, whereby we can actually ask a series of health-related questions that a patient answers, and depending on how they answer, that can contribute to their overall health profile for that particular day, and actions are then taken. So that's where telehealth sits. Telecare is very different. Telecare is around safety and protection. So having a series of monitors in the home that might look at how someone behaves and moves. So an example being a bed occupancy monitor, where someone is lying for a certain period of time consistently during the night. They may then get up during the night. If they don't return to bed within a certain period of time, it's an indicator that something has perhaps happened to that individual. And that's then monitored by a Lifeline Centre, a separate organisation that sits outside and can actually track what's actually happening with those. It's not just restricted to movement. It could be something that sits on the sort of door of a person's home. So somebody's got dementia that might be prone to wandering. They can have reminders about the fact that they shouldn't go out. You could play a message from a loved one that would say, you shouldn't be going outside. So it's that kind of protection element. But it's this simplest level is a pendant that somebody can press if they're in distress and need of assistance. And that's where the very different types of technology, but they work very well together as well.
Okay, cool. And how long has this project been running down in Cornwall?
We've been actually operating as a programme, and we started with the Department of Health at the back end of 2008. We really got going in February 2009. So in terms of real active participation, you're looking at around sort of 16 to 18 months worth of patients and people being installed with equipment and using it on a regular basis.
And how many patients have you got actually using it at the moment?
We will actually have, by probably the end of November, getting on towards around 1,800 between the Telecare and the Telehealth programs. So, and a fairly equal split in terms of those numbers as well. So I think that's probably where we'll get to. And then obviously as we move outside of the national trial that we're working at the moment, we'll actually see more and more numbers on a year-on-year basis as growth continues.